Have you ever felt pain in your hip during or after your yoga practice and wondered if it's coming from one of the hip tendons? I've been receiving some questions lately from students struggling with hip pain in two distinct areas, the outside of the hip and the lower buttock right under the sitting bone. Today I'm going to run through the common outer hip tendon injury called gluteus medius tendinosis, or glute med tendinosis for short. And most importantly, how to modify your practice and what poses to focus on to nurture and support the healing in this tendon. Firstly, let's look at how this injury tends to show up on and off the mat. If your symptoms on the mat are caused by a glute med tendinosis, then you may have pain in the outer hip area, anywhere from the outer upper thigh to the side glutes. Your pain is usually worsened when you're lying on the affected side, like in a supine twist, or when lying on your side in bed at night. You could also have pain when laying on the unaffected side, when the affected side is on the top in a stretch position. Again, like in a supine twist on the other side, or laying in bed without a pillow in between the legs so that that top hip is on a slight stretch. Your hip tends to feel okay during your practice, but feels worse later that night or the next morning once you've cooled down fully. Your symptoms are worse after doing a practice with a lot of standing balance poses. And your symptoms tend to be worse first thing in the morning and feel better once you get moving. So you may be wondering at this point, what is a tendinosis exactly? Is it the same as a tear in the tendon? Tendinosis basically describes a repetitive overuse strain to the tendon. And to understand tendinosis, we really need to unpack what is meant by overuse. Because what is overuse for you may be different from the person on the mat next to you who seems to come to class 7 days a week and never seems to have any trouble. Just like our muscles, our tendons respond to their load environment. That is, the typical loads that they're subjected to on a day-to-day basis. If you practice hatha or vinyasa styles of yoga regularly for years, but then you switched to only practicing yin for a few years or months even, your tendons would get used to the different loads required during yin and would reorganize their collagen matrix in response. The tendons have adapted their collagen fiber composition to this new altered load. And if we suddenly reintroduce a power yoga practice without graduating our practice and these loads back up slowly, we are more likely to experience overload in our tissues. And this is especially true as we age. This overload causes micro trauma or micro tears within the tendon, but no gross tear to any individual tendon fibers, and so no inflammation occurs within the tendon itself. Until the tendinosis is quite advanced, it also won't show up on a scan. Only when there's been a long enough period of overuse to cause a thickening to develop in the area of the tendinosis will it usually be seen on MRI. So the key thing to take away here is that overuse is relative. You could practice power yoga and run 10 kilometers every day and not experience a tendinosis in your hip if the hip tendons are used to these loads. If the tendon is repeatedly subjected to loads greater than it is used to, microtrauma occurs within the tendon and tendinosis is the result. The tendinosis not only causes pain in the area, but also further weakens the tendon, making it even more susceptible to overload. Another common question that comes up here is, should you stop your practice and rest? And actually, stopping your practice altogether isn't the answer. Rest alone will not solve the problem, because if the underlying issue is a relative weakness in the tendon tissue, then it stands to reason that rest will only make it weaker. The period of rest will often heal the tendon enough to reduce or eliminate the pain, but as soon as you start loading it up again, the pain will usually return, and often it is worse this time as the tendon has become even weaker than before. There is one situation that may occur that would require you to stop your practice and focus solely on a clinical exercise program. And that is in the case of a high irritability score. A high irritability score means that your symptoms are provoked with very little load. And that could be a very gentle, slow flow, or even going for a short walk. And it elicits a really high pain response that lasts for days or weeks afterwards. If you feel this is where you're at, then seeking expert advice and treatment from a physio and taking a break from your practice may be needed to recover. The two things to avoid or minimize in your practice when working with a hip tendinosis are, firstly, stretch. Stretching the tendon that has the tendinosis causes further stress and overload in the tissue, which really prolongs the injury. This may seem counterintuitive, as the feeling you often get is stiffness in the surrounding muscles and fascia, and you may feel compelled to stretch it out. But this really should be avoided until you've started strengthening the tissue sufficiently. And number two is compression. If the issue is in your glute med tendon, laying directly on your affected side will directly compress the tendon and likely aggravate the symptoms. Sometimes you get the double whammy. When the tendon is stretched, it also tends to become compressed by underlying bony prominences. Like in a supine twist, for example, the tendon on the top leg is not only being stretched, but also compressed as it is being pulled down over the head of the femur bone. Or in Warrior 3, when the standing leg drops too far into adduction, causing the gluteus medius tendon to stretch and also to compress down over the head of the femur bone. So now we're getting to the really important question, which is how can you modify your practice so you don't aggravate your symptoms? There are a few specific poses that tend to cause the most threat to overload, either in compression or stretch for the glute med tendon. I'm going to show you some ways you can modify these particular poses to reduce the stress of compression and or stretch in the glute med tendon. Firstly, in supine twist or Jatara Parivartanasana, if the affected hip is the top hip, then lay bang on your side with the hips stacked one on top of the other, and even place a block between your inner thighs. And this will reduce the stretch on that top hip tendon and the subsequent compression of the tendon down over the head of the femur. When you rotate from the navel and above to keep that top hip happy. If the affected hip is the underneath side, then when you rotate, start with the hips rolled back slightly, and that will take the compression out of that bottom hip slightly. Or use a blanket and place the blanket underneath the bottom hip to cushion that lower hip and reduce the compression. The second potentially problematic pose for the glute med tendon is warrior 3 or Virabhadrasana 3. So using 2 blocks in front of you to support your body weight and help you to keep the hips level will reduce the adduction in that standing leg hip and take away the compression and stretch in that glute med tendon. You can also reduce the load further by dropping down onto one knee on the affected side, which will shorten the lever and once again help you to keep your hips more level. And the third pose that comes up here is Vrikshasana, tree pose. The standing leg has a tendency to drop into adduction, especially if there's some weakness in that glute med. If you take the opposite foot lower down towards the knee or the shin, or even further to the floor, this will help to keep your hips more level and stop that hip poke that compresses and overly stretches that tendon. Do you want to know more about hip tendon pain in yoga? Do you have more questions like, how can you help your tendinosis to heal? And how long will it take? How do you strengthen your tendon the right way? If so, I encourage you to read my full blog article on this topic of hip tendon pain in yoga, which I've linked in the description below. I'm here to support your highest movement potential. Namaste.